Up to 10% of patients with diabetes develop diabetic foot ulcers, and when this occurs, 40% of them die within 5 years. That's even more than many cancers. But interestingly, with a good care, this is totally preventable in 90% of cases. So if you have someone with diabetes in your family, this video based on the latest diabetic guidelines is made for you. Diabetes affects your feet in two different ways. Firstly, it causes the blood vessels in your feet to become hard and narrow, resulting in less blood flow. This makes your feet pale and cold, and eventually ulcers in tips of your toes may occur that can lead to a condition called gangrene. Diabetes also lessens the ability to feel sensations like pain, heat, or cold. This means that you may walk on a pin or hit your legs to an object without even realizing it. As a result, gradually the shape of diabetic foot changes, making regular shoes uncomfortable for them and further damaging their feet. Now let's see what you can do to prevent this situation. Every day check your foot for ulcers, cuts, blisters, or redness. If you can't do this on your own, ask for someone's help or use a mirror to see the bottom of your feet. It is better to wash them every day and dry them carefully. And about moisturizers, you can gently apply moisturizers, but do not do this between your toes as this can result in infections. About toenails, keep them trimmed because long or thick nails can press on neighboring toes, resulting in open ulcers. When you are trimming them, trim straight across. Do not trim the corners of the fingers as it can result in a condition called ingrown nails. If you have corns or calluses, do not remove them yourself and visit a doctor. Also, do not use over-the-counter products as they can burn your skin. Avoid going barefoot, even in your home. This reduces the risk of injury. Also, wearing socks and shoes gives feet extra protection. Before putting your shoes on, check for any sharp objects like small rocks. Also, wear shoes that fit properly without hurting your toes. And if your shoes are not comfortable, ask your doctor about special therapeutic shoes that may be right for you. Now let's talk about diabetic socks. These socks should be white in color, revealing any bleeding or secretions. They should be made from soft cotton, and the top of the sock should not be tied as this reduces the blood flow to your feet. Some of these socks have pads that support the sole of the foot. There is also an antimicrobial feature in some of them, and the other feature is moisture wicking. Moisture wicking material is also important. This keeps your feet dry and avoids any infection. And lastly, these four general advices are important. First, stop smoking. Keep your blood sugar, blood pressure, and cholesterol under control. And then see your doctor annually for a yearly diabetic foot screening. Now, before the most important part of this video, if you like this kind of content, please like, subscribe, and comment. So what to do when something is not normal? If you see any cuts, blisters, or dry and clean wounds, not every wound, clean it with antiseptic solution and cover it with a dry, sterile dressing. You can do this yourself at home. Now, there are times that you need to visit a doctor within 24 hours. If you notice any redness, pain, swelling, or your wound has pus and smells badly, and you have fever and chills, in this case, you need to visit a doctor within 24 hours because you have an infection. By doctor, I mean a GP, a diabetes doctor, or a podiatrist. Lastly, there are times that you need to go to the emergency department immediately, as any delay may lead to severe complications, even losing a limb. Do so if you notice that your food is significantly colder than your other food. If you notice any changes in skin color, particularly if it's getting darker in color or blue, and lastly, if there is new severe pains going on. There was so much fun making this video for you guys. See you next time.